February. Now remember, this is your plug on to issues that make up your day-to-day life. Now speaking of which, one of you wrote in asking that we discuss peptic ulcers as they have been living with them for years and now they really do not understand why they will not go away despite constant treatment. This morning, we engage the expertise of a gastroenterologist to understand what peptic ulcers are in the first place, what causes them, and of course, why the disparity in symptoms and treatment plans among patients. My name is Gladys Gachanja. Before we get to that medical conversation, here is what else you can expect. Today, as I mentioned, we shed light on living and managing chronic ulcers. Election officials count ballots in the presidential runoff in Niger.
We have a ice runway here.
Planes land on a frozen lake in New Hampshire, and we have all the details. Well, Dubai launches world's tallest sky flyer, which is as tall as the Pyramid of Giza. Thank you for joining us on this broadcast. As I mentioned, today we get to know more about peptic ulcers. And speaking of which, that question of the day to you is, do you know someone or are you living with peptic ulcers? What are the challenges living with this condition? Talk to us. That hashtag is the new normal on our social media platforms. And remember, you can also call in using the numbers at the bottom of your screen for any questions for our specialist this morning. But before we get to that, let's take a look at the effects of COVID-19 around the world in terms of the numbers. And this morning, that number stands at 112,261,327 confirmed cases around the world. Out of that number, 87,786,600 have recovered from the same, and 2,485,364 have succumbed to COVID-19. In Kenya, that number stands at 104,306 confirmed cases in the country. 85,626 of that number have totally recovered. Remember, home-based care being lauded for the success rate, and 1,827 unfortunately have succumbed to COVID-19. Remember, as we say here every morning on your world, wear your mask, social distance, and of course, wash your hands with soap and water regularly. I take a look at some of the stories making headlines this morning, and an eyewitness describes watching a military plane crash near Nigeria's capital Abuja, killing all 7 people on board. Vivian Ude recounts that she saw, and I quote, the plane going down, and the next thing I heard was a big sound with fire and smoke.
I just came back from church. I want to go and buy something. Only for me to come outside the compound, and I saw plane coming close as if it wants to land in front of our compound. I just from afar seen the plane going down, as in at a stage I couldn't see it again, and the next thing I heard was a big sound with fire and smoke.
While election officials count ballots in the presidential runoff in Niger between favorite Mohamed Bazoum and challenger Mahaman Wasman, and now 7 election workers were killed early Sunday in Niger's troubled western Tillaberi region when their vehicle hit a mine. The blast also injured 3 other workers, who included the heads of polling stations. The accident came as Niger holds a presidential election runoff between frontrunner Mohamed Bazoum, loyal to outgoing President Mahamadou Issoufou, and former President Mahaman Osman. According to the area governor, the team had been sent by the Tillaberi branch of the National Independent Electoral Commission to monitor the polling. Elsewhere, FIFA President Gianni Infantino launches a project to organize a school football championship in the Democratic Republic of Congo to be replicated at the African level in the presence of President Felix Tshisekedi, current chairman of the African Union. Now, Gianni said the president of the DRC, who is not only passionate about football but also someone who fights against corruption and for good governance, is a guarantee for me as the FIFA president and for the whole of Africa to be able to work in this direction also for African soccer. We are going to replicate this championship throughout Africa from here because education, schools and football must be in symbiosis.
Ouais, vous êtes centre avant là. Le buteur de l'histoire du football. Non, Messi, c'est rien.
Vous savez qu'on peut aller plus haut. Ça veut dire que ce soit que d'aller d'ici à l'aéroport, par exemple. Voilà.
Ça, voilà. Le climat, de quoi il s'agit. Ouais, vous êtes centre avant là. Le buteur de l'histoire du football. Non, Messi, c'est rien.
Well, to the conversation of the day, we are trying to understand what peptic ulcers are, and this came from a viewer who said they've been living with them for many years and just don't understand why they won't go away, because they say there are friends they knew that they were in high school with and they seem to have gotten the right treatment and now they are better for it. So today we understand exactly what peptic ulcers are, and to help us with this conversation, in studio we have Dr. Christopher Opio, who is a gastroenterologist. Thank you for joining us, and he is from the Aga Khan University Hospital. We are also joined by those who know how this shoe pinches. Brian Moshiri, who is actually one of us here at NTV, living with peptic ulcers, and Faith Mweni, also living with peptic ulcers. Thank you for joining us on this conversation. Now, remember, just as we walk this conversation, that question of the day to you is, do you know somebody? Are you living with peptic ulcers? What are the challenges of living with this condition? Talk to us. that hashtag is new normal, and also you can call in using those numbers at the bottom of your screen. So before we get to hear more about the same, how about we just paint the picture what peptic ulcers are to start with? If you can have those graphics on the screen. Well, they say they are open sores that develop on the inside lining of your stomach and the upper portion of your small intestine. Dr. will tell us more about that. The symptoms are generally for those who have symptoms: burning stomach pain, feeling of fullness, bloating or belching, intolerance to fatty foods, heartburn, nausea. And they also say ulcers may cause severe signs or symptoms for some people, like vomiting or vomiting blood, dark blood in stool, trouble breathing, feeling faint, nausea or vomiting, unexplained weight loss, and appetite changes. So again, what are peptic ulcers? We've defined it, but let's hear it from the specialist, Dr. Pio. What brings about these open sores we're saying are in the stomach?
Thank you. You've clearly defined what they are in simple form. So they are open sores. So what you put up as symptoms and signs are actually dyspepsia. So I start from dyspepsia. This means abnormal. Pepsia means digestive. Okay. It's important to understand that most of the symptoms people present with are dyspeptic symptoms, quote unquote. The causes of dyspepsia are many. Among all, that includes peptic ulcer disease. So you can have gastroesophageal reflux disease, which is acid reflux. You can have other causes, for example, tumors, cancers of the upper abdomen. Rarely you may have heart disease that may present with those symptoms. And you may also have respiratory disease. Even COVID per se can present with those symptoms. Then we have the so-called functional dyspepsia, where you don't find any disease or pathology, but yet the individual continues to have those signs and symptoms. So we're talking about peptic ulcer disease. So peptic ulcer disease means, just basically means, peptic means digestive, ulcer means the presence of an ulcer. An ulcer is just a wound in the stomach, and initially it starts from injury to, you can start with inflammation to injury, to a small little erosion, then to an ulcer. The ulcer may be complicated by bleeding. You may have a huge sore that may perforate through the wall of your stomach or intestines, and there you may have to get admitted. But more than not, most people just present with abdominal pain, discomfort, but eventually the ulcer may degenerate into a cancer. That is the worst part of it. So the causes are mainly two. So 7 out of 10 individuals, 7 to 9 out of 10 individuals, the main cause is Helicobacter pylori, which is a bacteria. We say it's a gram-negative bacteria, which is found in resides in the lining of the stomach. How do you get it? It is got, scientifically we say oral or orophycal. So in other words, you get it through your water, your food, from your environment. So most people get it as children. So, and it may reside and persist, but even adults can get it, okay. And so you may have food contamination, which is, I think, the most common cause. And this bacteria was discovered. Okay, Marshall, there were two doctors who got a Nobel Prize for it in the 1985. That was Marshall and Warren. So what these doctors did was to infect themselves with the bacteria. So they proved that it was an actual disease, and they treated themselves. That's why they got the Nobel Prize. But this bacteria has been with us for quite a while. In fact, the first record of it, that it was a cause of peptic ulcer disease, was in 1880. by Klebs, so where they demonstrated the bacteria in the lining of the stomach of individuals. So this bacteria is currently the main cause of disease worldwide, and it's associated with poverty, but in certain environments you may also get it, okay? Like for us who are digestive disease experts, because we live in an environment of taking care of patients, we are more at risk of getting it. And if you have a family member that has it, probably you're more likely to get it. And
so this is H. pylori.
Yes.
Okay, what's the other cause?
So the other main cause is drugs. Drugs. So mainly painkillers, your Maramoja, your aspirin, your diclofenac, your brufen, and so forth. So these painkillers, apart from Panadol, tend to cause injury to the intestinal wall. And they can be a cause for admission, because patients end up bleeding, and sometimes they may end up vomiting. Then you have rare tumors. So if you're going to take anything, it's just those two, Helicobacter pylori and drugs. And drugs, if you talk about drugs, you have to include herbal medications or traditional herbs and so forth. There are certain medications which will cause irritation to the stomach.
All right. Yeah. So at this point, let's hear from those who live with this condition. I'll start off with you, Faith. When did you get a diagnosis of peptic ulcers?
Okay, for me, when I was in class 6, I can say that is the time I was not diagnosed as per se, but that is the time I started experiencing like burning sensations on the stomach. And I think that was associated with, I lost my mom at that particular time, and with the stress that came with it, pressure and overthinking. So I can say that's the time I started feeling that burning, and I didn't know it was ulcers. So I continued like that. When I went to high school, I was still experiencing the same, but more so it got worse when I was exposed to stress. So it went on through high school until I finished my college. And then when I was working, I'm a lab technologist, I was working in Gachanja, is when I started experiencing serious bloating, heartburns, and I was like, what am I going through? What am I suffering from? I started testing. I tested for salmonella. I tested for stool for ovarian cyst. Nothing came out of it until I started having diarrhea. It got serious. It was now mucoid. It went ahead and it became mucus with blood. Then that is the time I thought of H. pylori. I tested for the H. pylori. It was very positive. Then I took the kit that went for 2 weeks. After 2 weeks, I retested. It had cleared. So I don't know whether still it is the one that makes me still up to date feel that burning, because every time I'm exposed to stress, I still experience such a burning every time I'm exposed to stress. So I think it constituted a lot on maybe digesting my wall, my stomach. So I still have the ulcers, which every time I'm under stress is when I experience the burning. The other time I'm not under stress, I'm okay.
Okay. Let me hear from Brian. Is what Faith is saying familiar to you, or your story is totally different?
I think for me, it's really been a journey, because as Daktari said, it also could be courtesy of a family member having been part of this journey. Like for my family, straight from my father and my mother, they both have this condition. Narrows down to my siblings and gets to me. My journey started when I was perhaps 11 years old, perhaps in class 5, and begs the question, mtoto mdogo anafanya nini na ulcers? But as Daktari says, they termed it as bacterial ulcers. And for me, they started as a misdiagnosis, saying that my appendix needs to be extracted. Then it became just another normal stomach ache. But in finality, they got to now diagnose it and termed it as bacterial ulcers.
Okay, and what were your symptoms?
Just that burning sensation. You see, perhaps when you pour a cola drink in a glass, that effervescence kind of sensation, it really burns in the stomach. So that's just the main kind of symptom that you feel in your stomach. And then when you're extremely happy and excited, and when I'm extremely sad and stressed, it also comes about where you just feel that aspect of effervescence in your stomach.
Okay, now let's hear from Dr. So two things come up here, and perhaps this is where we'd like to bust some myths or misconceptions, if at all. Stress and spicy foods do not cause peptic ulcers. Fact or fiction?
Fiction.
Why?
So fiction is the science doesn't talk for it, okay? And the fact is that as I described dyspepsia, so when patients come, they describe symptoms and signs reminiscent one of their social network or their culture and so forth. But the symptoms, yes, are similar across cultures and so forth. So a patient may have, say, liver cancer, and they may present with dyspepsia, okay? You may have Helicobacter, you present with dyspepsia, okay? You may have reflux, you present with dyspepsia. So there's an interlink. So one has to drill in and find out what is the actual cause, okay? And then you have the issue of functional dyspepsia I talked about earlier, which is related to stressful events and so forth, okay? So that one is all a different ballgame altogether. And it may be because you have secretion of particular stress factors that may irritate the stomach. But remember, the digestive system is directly connected to the brain. I would ask you, when you're stressed, which part manifests? Okay, where do you feel your stress?
Oh, okay, I would have a headache or a stomach ache.
Yes, you mentioned it, stomach ache. So you see, so there's a kind of a link between the two.
Okay.
So I think people overstress the issue of stress.
All right. So in both cases, they say they get the burning sensation, especially under stress. So is the issue that that condition increases the acid levels in the stomach? Is that what we're saying?
It would be conjecture to say so, because everybody is different, okay? So it's not one size fits all.
Yeah.
So when we come and see patients, we try and put everything together, because the individual is not that just the stomach, or the individual is the heart, the brain, and so forth, and etc. So that would be kind of the difficult question to answer, but really what people have noticed that it is related. So we presume that, yes, there are certain, it has been shown that certain hormonal factors are released in between and so forth, yeah.
All right, Faith, I'm curious to know, have you had to adjust your diet to manage the peptic ulcers? Faith?
Okay, for me, there's no food that I cannot eat. Even sukuma wiki, I do eat. I think mine had not advanced to that level where food is an issue, except that time when that sensation is, maybe to mention, when I got married, I experienced this a lot, more than any other time, because you know, when you get married, there are those expectations you have. Maybe you don't want to share with your partner and you expect them to know. So due to keeping quiet and going through issues alone, I started developing that. That is the time when maybe I ate sukuma wiki. That is the time I could feel that. So when I realized that that was the issue, I decided I should share with him. We talked and I opened up and everything came back to normal, and then everything subsidized. So for food, up to date, I don't have an issue with any food that is acidic.
Okay, let me go back to Dr. Faith had mentioned that she had a H. pylori infection sometime in the past. Could that also have a direct relation to why she keeps getting the lapses?
Yeah, it's possible. You see, as I mentioned, dyspepsia from the patient's perspective is different from the doctor's perspective. So but we kind of try to think from the patient's perspective. So if you have Helicobacter pylori, it's difficult to clear. in this day and age. It is one of the top 10 most difficult bacteria to treat. Why so? One, we have indiscriminate use or abuse of antibiotics. So you'll find antibiotics in food, okay? And the reason it is in food or animal products is because we use the antibiotics to kind of grow the animals and so forth. So you're going to have a lot of antibiotics in food. So the bacteria is able to adapt. Then the second point is that there is an indiscriminate use of antibiotics by whoever is there, health practitioners and so forth, without testing. So the gist of the issue is one should actually test before. So this bacteria is actually one of the top 10. If you go and Google WHO top 10 bacteria, it's one of the most difficult to treat. And unfortunately, we're not getting new antibiotics for that bacteria. So you have patients who are being treated over and over and over again. So the faith probably could have the bacteria there, but it is not cleared. So immediately you take the drug, you may have, the test may turn out negative, but later if you test, say 3 months down the road, somebody is positive and they say, I am positive several times, I have to be treated several times. So that's probably what we call antibiotic resistance. But in truth, it's called treatment failure. So treatment failure may be due to antibiotic resistance or reinfection. So I may have, I may live in an environment where I have continuous exposure to the bacteria, so I get reinfected. That is one point. So Helicobacter may be there, or alternatively, you may have two diseases in one. Okay, so you may have acid reflux. So acid reflux is treated different from Helicobacter pylori. Pylori is treated for 2 weeks with antibiotics and antacids. Reflux, because you keep on getting small reflux and acid to your gullet, is treated for 8 weeks, but it may recur because you continue to have reflux. So that may be the issue. And if somebody continues to have those symptoms, we need to do further evaluation to check our diagnosis. Are we correct or are we wrong? Are we missing out on anything? Okay. Last but not least, you have the functional bowel disorders, okay, which may present like this. And remember, when you use antibiotics, you may change your bacterial flora from good to bad, okay? And that causes disordered environment. So individuals may have a little bit of burping and so forth, discomfort, all that stuff. But remember again, because people have discovered that you change bacterial flora, there's kind of melee going out there. Everybody's taking cooked up bacteria, I would say. Okay. So they say we take these probiotics, as we call them. So, but if you look at the studies, they are only specific probiotics and the indications are very clear. So every time somebody comes up with a solution, somebody misuses that solution.
Makes a lot of sense. Okay, I hear we have a question from Joel, who is calling in from Kisii. Joel, go ahead.
Okay, morning, today I'm doing care. My name is Mayaka Joel. I collect to Dr. Valde, whatever we are discussing on the screen concerning.
Joel, we can barely hear you. I think we have a problem with the connection.
You are talking with Mayaka Joel.
Okay, we will have to call you back because the connection is not so good. But I hear we also have a question on our social media handle, New Normal. That is what Robert Orioke, who says from Kisii, I'm suffering from peptic ulcers and have been since 2013. When I take meat, I do suffer much from burning sensation at my left hand side. How can you help me, Daktari?
You need to see your health practitioner. It's difficult to help you through the...
Okay.
Yes, so they need to evaluate you and find out what is going on. As I said, we have listed the different causes of your dyspeptic symptoms. Peptic ulcer is a diagnosis when a doctor actually looks into your stomach and sees an ulcer or an early ulcer, okay? So it's difficult for us to, all we can say is find a health practitioner who can help evaluate your problem in evidence-based manner. You have the tools now. You know what it is. You know what it could possibly be. You just need additional help to go through those different possibilities.
Okay, let's go over to Brian. Brian, what is your situation? Do you have to tiptoe around your diet to manage the peptic ulcers?
Yes, Gladys. As I mentioned earlier, my case started when I was about 11 years old. So I'm still in primary school. In a typical Kenyan primary school, you have githeri, so you have beans inside there. Go over to a secondary school that still has githeri, still have beans inside there, and you have really spiced food. Post school, that's past university. In your regular event at a wedding, you have pilau, you have spiced meals in there, you have beans, so it really now narrows down to personally getting to a situation where I have to look at my own diet independently and say, I can't have this, but I can have this. It also gets to, even in the office here, me coming with my food straight from home, not because of any special thing, but because I know that any meal that I will get outside there might be quite too spicy for me, or might get really tough for me. Narrows down to drinks like soda as well. You can't just have any regular soda anytime that you want. Yogurt or something. It really requires me to check out my diet.
Does any of this sound familiar, Dr. Tarin, as far as management of peptic ulcers?
Yes, it does. Food. So people use food for treating disease. People use food for so many things, for pleasure. So the issue is, as our esteemed colleague did mention, it is not one size fits all. Okay. The rule of thumb is eat healthy and choose your foods. Okay. Different people would have different preferences. I don't sit in your kitchen and cook the food you want. So for me to prescribe a food for you is a little bit wrong. But I can say generally that you need to eat healthy. And eating healthy mainly means you look at the various foods that you have, okay? Because it doesn't make sense to limit your food if you're starving, okay? Or it doesn't make sense for you to eat the wrong food just because you feel XYZ, because it can impact on your health eventually. So my suggestion is it's not one size fits all. Different people respond differently to different. In fact, there are particular diseases that are associated with certain exposure to certain foods. For example, celiac disease or gluten disease, you're exposed to wheat, so you can't tolerate it for various reasons and so forth. But overall, it's the individual to choose the healthy food. And the rule of thumb is more vegetables and fruits, maybe 50%, then the rest, carbohydrates and proteins, that is animal proteins. The other 50%, maybe 1% fats or something of the sort. Yeah.
Okay, so in this case, are we saying now if somebody has a direct correlation to a certain food that irritates them, it would be prudent for them to actually manage it from that point of view, right?
From their point of view, yes.
Okay, and is it also an issue of the additives perhaps that we put in all foods nowadays?
Yes, as you know very well, there are a lot of additives and so forth. Sometimes, for example, if for me, I take shrimp or cooked in certain way, I may react to it. I may get chest tightness or something of the sort. Others, maybe they may eat nuts, especially if you're Caucasian or something of the sort. You get a reaction to it. So different people. Some people may eat meat and they get hives all over. So it varies. Some people may eat certain foods and get diarrhea, but it doesn't mean that all foods are the culprit of it all.
Okay, but now that we're talking about the change, the acidity in the stomach, are there some foods that you can actually say, okay, fine, we clearly know the composition of this food, so it's bound to go and exacerbate the situation?
If it is healthy food, there's no link, in my opinion.
Okay.
If it is healthy food, okay. But if you start manipulating food in such a way, then you're going to have problems. Yes, some people cannot tolerate the sodas you have. But remember, the normal stomach produces acid, and it's the normal environment. So acid has its advantages. Okay, so if, for example, you eat certain foods that are contaminated, and if there was no acid, you end up having more infections. Okay, so there are benefits and disbenefits of the acid, but still, the message is that if you eat healthy and you choose your foods, that should be fine. I don't want to prescribe because they are different people.
All right.
Yes.
Okay, so there's another question from Lillian in Bungoma. What's your question?
I have a cat, and he has been having a problem stomach, the and nowadays he's choosy about food. He doesn't want spicy food, and sometimes when he's stressed with food, he feels the stomach pain. Now, according to the way that has explained, maybe I don't know if it's the cause of it can be ulcers or any other problem.
Okay, I got bits and pieces of that, but you mentioned that you eat certain foods and you get stomach pain, and you're not very sure if that is gastritis or ulcers? Okay, so Dr. I think it brings us to that conversation. What's the difference between a peptic ulcers and gastritis, at least from the doctor's
gastritis comes, stomach is called in Latin gastrum, and itis means inflammation or injury, if you want to make it simpler. So when you have gastritis, somebody has looked into your stomach and seen, and probably have taken a piece of tissue or scrapings, and they have seen that you have inflammation in your stomach lining. So that is gastritis. Gastritis may be usually precludes formation of ulcers. Remember, I talked about injury, so that's the connection. So some doctors will say gastritis, others would. So it's surrogate marker, but you need to do an endoscopy and a biopsy for you to actually confirm the presence of gastritis. Yes.
All right, then. I hope you caught that and the importance of actually going for a proper diagnosis of the same. We still have Joel joining us from Kisii. What is your question again? Joel?
Yeah. Hello.
Yes.
Morning, NTV. I'm getting you well. I'm Mayaga Joel, and I'd like to add something concerning these peptic ulcers. Actually, not all the abdominal pains or the stomach pains that can be called the peptic ulcers. Somebody may start from the gastric pain, that's gastritis, then end up to be having the ulcers itself now. Nothing I could like to talk about is that one of the causes, the major causes of this disorder that we are talking today is that I don't know whether you were imagined of yourself eating something in the morning, you are spending much time in your office, then as long as you end up being told that you have ulcers. Actually, what brought this one is that most of the time our stomach is like a watch, which you can set on say, this is when this reaches, please call me for an alarm so that I can go for the job or I can attend somewhere. Actually, our stomach also behaves in that way. Whenever it comes the time that you need to take something, there is an acid being secreted from our mucosal walls of the stomach. And these, whenever they reach into our stomach, they realize that there is nothing in the stomach. That's when now it will start to react with these very walls and now leading to corrosion of the mucosal walls, leaving the wounds on our stomach.
Okay, Joel, are you a doctor?
I'm a nutrition by profession.
Okay. So this is something that you have seen with many of your clients?
It has been a problem. Somebody telling me I have ulcers, what are the causes of these ulcers? I see I'm living a comfortable life, but doesn't know that there is something very slight that is messing up with.
All right. Thank you for calling in and contributing to this conversation. Dr. An empty stomach is a good breeding ground for peptic ulcers. That's what the nutritionist is saying.
I think yes and no. I think there has to be a correction in this, in the sense that usually you need to know the physiology, okay? So yes, if the stomach is empty, you're more likely to have abdominal pain, okay? But development of ulcers is a process. It's just one-off day or something of the sort. It goes through a process: injury, erosion, and of course, ulcer formation. So that is a process. So that is where we need to where we differ. It just doesn't happen one-off. If you're going to get an ulcer which happens one-off is if you have a direct toxic effect. For example, certain drugs, or if you've taken certain caustic, because the lining of the stomach actually has a protective layer. If you look at the surface, for example, of this table, it is shiny.
Yes.
Yeah, so it has a protective layer. So if there's a breakdown in that protective layer and there's an imbalance in the protective factors, then you will have injury and formation of the ulcers. Yes, there are hormones involved, but that is how it is. So we have to think of it as a process.
All right. Yeah. And perhaps that would answer for those that correlate stress and peptic ulcers. Perhaps when you're going through that period, you're not eating well, and now you're getting more acid in your stomach, and perhaps now puts you at crossroads with peptic ulcers. Is that what we're saying?
It is possible, yes.
It is possible. All right. We have another caller from Kisumu. That is Eva. What's your question or comment, my dear?
Yeah, good morning, Gladys.
Good morning.
So my daughter tested positive for H. pylori late last year when she was 6. Now she's 7.
Yes.
But now the problem is she complains of stomach aches every day. Everything she eats, she'll say, "Mommy, my tummy is aching." So every time we go to the hospital, she's given the same antacids and antibiotics. So I was wondering if the doctor could help us, maybe to know what I can use or what she can use to ease her pain, please.
Okay, thank you, Eva, for calling in. Daktari, this is a 7-year-old child who seems to have had a H. pylori infection, and ever since they have stomach problems.
So I empathize with the mother, because going to hospital every time because your child, and every time your child tries to eat something, has abdominal pain, you need to see a health practitioner, and probably a specialist at that, okay? Pediatric gastroenterologist, if not, if the pediatrician or pediatric gastroenterologist is not available, you may see an adult, sometimes, gastroenterologist, if there's nobody else. But at least see a specialist, and they try and tease out what is going on. As I said, the child could still have Helicobacter pylori, that is one. But in children, you may also have what we call reactions to food or food allergies. But you also have to look for other factors. For example, as I told you, if a child is stressed at school or for whatever reason, they may present with abdominal pain. So one has to think broadly. And there are other diseases, so-called metabolic diseases, that children can present with, okay? So it's, as I said, it's difficult, but you need to see a specialist so that they can look through all these possible causes. And looking through the possible causes, hopefully then they will come up with a solution. Yeah. Sometimes children, just removing them from a stressful environment, you discover sometimes the eating habits, sometimes the food and so forth. But still, as I say, one cannot make a diagnosis here and propose a treatment. All we can just say is to support you to go and see another or see a specialist.
Okay. All right. And back to you, Faith. Let's talk about the management or the treatment of this condition. What have you been on?
Okay, since I did the treatment for the H. pylori, that was all. Since then, I realized that stress was taking me down, and I decided to myself, why should I be stressed by things maybe I can't change? And I decided to live one day at a time, no stress. And if I see something is really stressful, and I don't keep it to myself, I share it out, and I realize, oh, it was not that serious. So what I can say has helped me so far is in the management is avoiding stress at all costs. As Dr. said, okay, they dispute that stress does not cause ulcers, but to some extent it contributes because it affects the mucus that lines the stomach. So once the mucus is not there, I mean, the acid is now there to corrode or erode the stomach wall. So I avoid stress by all means, and I make sure I consult. And at work, when I realize that something is going to subject me to stress, I don't put myself to it if I cannot make it. And I don't have pressure to that. If it's something I can say no to, I'll say no with no apologies. Because if I say yes, I will do, and I know very well I cannot do, then it will give me a lot of pressure and stress at the end.
All right.
So I avoid all that by all means.
Do you take anything orally?
Sorry?
Do you take anything orally when you get an attack?
No, I don't take anything. I just avoid the stress as much as possible. Like right now, I'm undergoing a very stressful situation, but I try my level best not to think about it. As I said, I live a day at a time.
Okay, and Brian, how do you manage?
As I said, I got this while in school. So in the entire of my schooling period, I have always had a tin of cocoa. So when other students and other people used to have chai ya majani, I would have my cup of cocoa. One would argue it's a group of schools, and also an aspect of having a glass of milk at least regularly. So maybe when I have an attack, I treat myself to a cold glass of milk. It really helps me, at least as far as that. And then again, living a day at a time. I realize there are very many things that that I put in my head and my mind that are not really important and are not really necessary for me at that point, at each point in time. So just live a day at a time.
Okay, we have another caller, Peter from Machakos. I think we just lost him, but we'll get back to him in a moment. Daktari, when we talk about the treatment plan, is this dependent on perhaps the severity of the ulcers?
Yes and no. You have to treat the cause. So if you treat the cause probably, of course you have to treat, if it is severe, there are different treatments for mild, moderate and severe disease. So for example, if you have a bleeding peptic ulcer disease, basically you may need interventions like endoscopy to stop the bleeding. If you have a perforated ulcer, you may have to have a surgery. But if you just have an early ulcer, maybe demonstrated on endoscopy, or just erosions, you may just treat with, you treat the cause. And the most common cause is Helicobacter pylori. Yes, and if you're on, for example, the non-steroidal anti-inflammatory agents like aspirin and diclofenac, you stop those drugs or you add an anti-acid. Okay, so that is what we really do. If you suspect somebody has, say, gastrinoma, you may have to treat that.
Okay, I remember in high school there was this liquid that those that had ulcers used to drink. It was white in color. I forget its name. Is that something that is common, and what does it have that kind of calms the ulcers down?
So basically the thinking is that it is kind of alkaline, and it works best for the reflux. It may work a little bit for the ulcers, but it's not as effective as the other drugs. Okay, so as I say, you need to treat the cause. But somebody can have two problems in one. So it's as I said, it's not one size fits all. If you come with one size fits all, then you may get stuck in treatment.
We still have Peter from Machakos on the line. What's your question or comment?
Yeah, morning, Gladys.
Good morning.
Yeah, I'm Peter from Machakos. Yeah, I was diagnosed with H. pylori last year,
Mm-hmm.
and I usually feel my stomach.
Yes.
Yeah, I usually feel movement in my stomach,
Mm-hmm.
but I was told it is Bowel syndrome.
Okay.
But it has affected me for some time.
Mm-hmm.
Hello?
Yes.
Yeah, I'm kindly requesting you to ask Daktari
Okay.
what is the best medication which is the best medication for me.
All right. Thank you,
Yeah.
Peter, for calling in. Daktari, what is the correlation here? H. pylori and now bowel syndrome.
So, as I say, H. pylori, if you're given antibiotics, it may disorganize your bowel flora, and you may degenerate sometimes into what we call irritable bowel syndrome.
Mm-hmm.
So irritable bowel syndrome is a syndrome in itself, and there are the various criteria for diagnosis of it. It's a little bit complicated here, but you may have the constipation type, the mixed type, and the diarrhea type. So irritable bowel syndrome is rather difficult to treat because we consider it a functional bowel disorder. So it depends on the individual. I would just say I'll ask our esteemed to basically see a doctor so that they can make sure they don't have anything else. Because, for example, irritable bowel syndrome, if it is upper abdomen, you need to rule out, if you're older and you've had it for a long time, you have to rule out other things. For example, are you developing a cancer? Are we treating the right thing? If it is lower down, you have to rule out colon cancer. And you don't want to sit on that because the next thing you'll be telling us, oh, you missed a diagnosis. So the irritable bowel syndrome is a diagnosis of exclusion. So we exclude everything else, then we say, okay. And even treatment of irritable bowel syndrome is a challenge even to the doctors, whether you are in the US or whether you're on the moon or wherever, it is still a challenge because it is not one size. Each individual will behave differently because, as I told you, there are social, cultural, and there are physiological factors involved. Remember, health is about the physical, mental, and yeah.
Okay. Now, Dr. you have emphasized that our callers need to talk to specialists, gastroenterologists, yes. But those are very few and far between in this country. When we come back, we'll talk about the health infrastructure and how it supports diagnosis of this condition and, of course, what else can be done to manage this condition. We'll be right back.
Up to the hottest morning show. Tina Kagia, The Morning Fix, Nation FM.
Hey, how are you doing? I am Tina Kagia, aka The Voice. And every single morning, starting from 6 up until 10, catch me on The Morning Fix on 96.3 Nation FM, where good music lives. Let's have awesome conversations. Talk about life, love, money, politics, school, education. No topic is out of bounds.
Mornings with Tina Kagia, 96.3.
Nothing but the best of conversations. Talk about your stories, because honestly, it's important to unwind. See you every day.
All the hits with Tina Kagia.
They're my morning show.
The Morning Fix on Nation FM.
Nation FM.
Where good music lives.
Maji mdosi wangu ametupa simu yangu ndani ya maji.
Mdosi wako kwa sawa. Venye Nkirota ameniambia ajui na akimpigia simu ashiki. Hey, guy, what the?
For the women who deserve more, Moped is now in Kenya and more than 40 countries. With its nylon-free surface, new Moped has unique softness and up to 100% protection. Your skin will love it.
The Nation.Africa Digital Summit is bringing together the continent's most indigenous marketers and business and thought leaders to share relevant knowledge and frameworks for implementing digital-ready roadmaps. This year's summit will be held on the 25th and 26th of February at the Sarova White Sands, Mombasa. Do not be left behind. Join us in this digital transformation journey. Book your slot now. Call 020-3288-523 or 0719-038-523 today.
Did you see the girl that I was with?
The waitress?
I think I kissed her.
You what?
She was gorgeous.
Hivi utajipata wife, shida za pesa ndogo ndogo ziishe.
Kuna mtu mwingine?
Anaitwa Pop. Kwani wewe ni mechanic?
Mufanya wera mengi sana.
Na hii jina yako Pop ni nickname. Na wewe umeoa ama uko single?
Sina mtu.
Madem unapenda dem unaweza muita labda wife in future. Unapenda dem anakaje?
Mimi napenda madem wako na godoro.
Ni ukweli imeshuka bei. Smartphone ya nguvu 4G screen kubwa ya kuwatch game ni 3999 pekee. Ni ukweli.
Pata smartphone ya nguvu kwa bei nafuu kutoka kwa duka la Safaricom au dila leo. Safaricom for you.
Maie, hii nayo utangoja sana nichukue. Sichukui, niko juu ya pikipiki. Na sheria ya barabara inasema heri kupata missed call kuliko kupata ajali.
To get Piki Piki by Addis Jojo, dial star 811 star 936 hash. Skiza, Non-Nation.
Try Panadol Advance for relief from headaches, body aches, and fever. With Panadol's Optizorb formula, the tablet gently breaks down in the stomach, quickly absorbs, and starts providing pain relief in 15 minutes. For fast and effective pain relief that you can trust, try Panadol Advance.
Thank you for staying with Your World. My name is Gladys Gachanja, and today we're focusing on peptic ulcers. We have Dr. Christopher Opio, who is a gastroenterologist, helping us decipher the medicinal point of view. And of course, we have Brian Mushiri and Faith Mweni, who are both living with peptic ulcers. Before we get back to that conversation, we had asked you on our question of the day, is do you know someone or are you living with peptic ulcers? And what are the challenges living with this condition? That hashtag is new normal, and you can also reach us using those numbers at the bottom of your screen. Athanas Mutua says, Daktari, tell us the difference between peptic, gastric ulcers and all other ulcers. Athanas Mutua, I think at this rate we need to go one at a time, if you'd allow me, Daktari. Let's start with the first question. What is the difference between all those?
So peptic means digestive, and ulcers mean a wound. So digestive wounds, we can say, in the lining of the stomach and the duodenum. As we have talked about, we mentioned something about gastritis.
Yes.
So gastritis is a diagnosis technically by biopsy after endoscopy, but it can be also after operation of your abdomen and biopsy of your stomach. So one is more exact than the other, but there's an interlinkage.
Okay, and the symptoms are similar?
Symptoms are similar.
Okay.
Yeah.
The next question, please. We have Jay Dan, who says, I'm having the same problem. I can't eat beans, kales, and also oranges. Please help me. Jaden seems to be having the same issue that Brian has. If you can have the next comment or question. Athanas Mutua says, does H. pylori cause ulcers or ulcers cause H. pylori? Good question, Daktari.
H. pylori causes ulcers.
There you have it. Okay, on to the next question. The last one here, Robert Orioki, who says, Daktari, does peptic ulcer cause seasonal hiccups?
Yes, it can.
All right.
Yes.
And again, what is the relation?
So if you have inflammation, so hiccup is basically contraction of your diaphragm, okay? So if you have any irritation in the stomach or of the phrenic nerve that supplies that area, you can have a hiccup. So you have involuntary contractions of the diaphragm. So usually it's related to severe peptic ulcer disease if it occurs, but most of the time, sometimes the hiccup is just functional. Or sometimes if you take, for example, a soda, you can get the hiccup for whatever reason, so forth. So,
okay.
Yeah.
Somebody is saying we see children hiccuping all the time. Some cultures say it's because their stomach is expanding to give them room.
That is true in the sense because you are stimulating the phrenic nerve, and probably sometimes you may stimulate the diaphragm, which is near the stomach.
Aha, yeah. Interesting perspective. Now, Daktari, peptic ulcers include gastric ulcers, as you mentioned, duodenal ulcers. These two, are they based on where the ulcer is?
Yes, please.
Okay.
Gastric is in the stomach, duodenum is in the first part of the small intestines.
Aha.
Yeah.
All right, let's go back to Faith. We had Brian say that his family members all have peptic ulcers. In your case, are you the only one?
Okay, for my case, my sister has worse because she has been hospitalized on the same. There are foods she cannot take, unlike me. That is how she manages it. So there is also my brother who has ulcers, and theirs are a bit severe compared to mine.
Okay, when you say your sister has been hospitalized, what exactly was going on? What were the symptoms that were so severe to necessitate hospitalization?
The burning sensation was unbearable, the bloating, and she's been treated for H. pylori on several occasions, and actually like 3 times so far. And the problem is still persisting. So taking the advice of the doctor, I think now I will advise her to seek better medical advice, because it was not long ago when Corona broke and everybody was on lemon, and that was the cure for COVID.
And ginger.
So she took too much of it,
and
now it took her to the hospital.
Okay, interesting perspective. Brian, in your case, how bad does it get?
It can get really tough sometimes. That situation where it's 3 a.m. in the morning, it is paining, it is burning really, really tough in the stomach, and you sometimes even find yourself wanting to sleep on a cold floor. Just, yes, I said it, on a cold floor where you have the tiles. You hisi to your baridi because inside you it's burning very bad. Sometimes you have to at least seek some medical attention, perhaps from the family doctor, just to make a call and say, this is what I am experiencing, how do we handle this? And medical attention sometimes is usually the immediate way of handling it, but it can get really tough sometimes.
Compared to other family members, are you the one who has it worse off?
Yes, as compared to everyone else, mine at least was the epitome of everything. Mine is the more concentrated one as compared to everyone else in the house.
Okay, I'm curious to know if you can have both Brian and Faith on the screen. Have you both, okay, at least Faith says she's never seen a gastroenterologist. Brian, have you?
Yes.
You have?
Yes.
So when you say you're making a call to a doctor, it is a specialist?
Yes.
All right. Daktari. Connection.
Let's look at the causes. So what is the most common cause of peptic ulcer? It is Helicobacter pylori.
Yeah.
Okay. So is it genetic? Yes and no. Yes, in the sense that you may be more predisposed to get infection, okay? and know that it's an infectious disease. You're within a family, you're within an environment. So as long as you have somebody else in that environment who has Helicobacter pylori, you may be exposed to them. And remember, you're also continuously exposed to food and water that may be contaminated with Helicobacter pylori. So I hope I answered that question.
Okay, yes, you did. Let's just go back to H. pylori, and you're saying how infectious it is. How do you pass it on?
So it is
from me to somebody else.
It is oral, fecal. So oral means saliva can be a source, okay? Fecal means you may have even hands to mouth, okay? So you just need to get in contact with the material that has Helicobacter pylori, and
you get infected.
Yes. So all of us at one time put a finger in the mouth. So.
Sounds more like what we're dealing with today.
Yes.
I mean, with COVID and all. All right. And if we have more of your questions, we could have them up on screen or even take those phone calls. But even as we talk about the management of this, just reading on the symptoms, especially the nausea, the heartburn, intolerance to fatty foods. Faith, is this something that you also think about? Like there's some foods you just cannot stomach?
Okay, for me, what I avoid mostly is spices, spiced food. I don't spice my food, which is also healthy. So I avoid spices by all means. For the other types of food, there's no food that I can put a finger on and say I don't take this.
Brian, quickly, do you deal with nausea, or this is not something that you've had to deal with?
Once in a while, you have to deal with nausea because you've just consumed something that didn't quite go down well with your stomach, and you feel the urge to just bring it out immediately. So that happens, but not too regularly. Too regularly.
All right, we have a caller from Mombasa. That is Florence. What's your question or comment?
Hello, morning, Gladys.
Good morning, Florence.
Nilikuwa nataka kumuuliza daktari. My son amegonjeka H. pylori. Lakini nikaenda hospitali nikaambiwa nikapewa kits. H. pylori kits for 6 weeks. Ametumia, amemaliza, nikarudi tena for check up. I thank God that amepata na amepona. And then mimi mwenyewe nimeugua ulcers peptic for 23 years. Kama vile mwenye ameeleza. Lakini I thank God huwa naendelea nakula vitu vya spice. Nilikuwa nakula kuchemsha but mpaka nikaachana, nikachoka na hii boys. Sasa huwa nakula machungwa, but nakula ile machungwa ile tamu ile supermarket, lakini not pineapple. Nakula mango, banana, sometimes ukila sweet banana inakuletea acid sana unaungua. But nakula sukuma wiki, but not spinach. Nikula spinach nitalala chini. But kidere I eat, nakunywa maziwa, then maisha yanasonga. Na I thank God niko paka size. Baadhi yangu ilikuwa kali na nikawa nalazwa hospitali.
Okay, Florence, asante sana, and we are thankful umepata nafuu,
Nashukuru.
Sawa.
H. pylori nashukuru kijana wangu amepona. Jua nimepatilia zile kits za H. pylori for 6 weeks. Nikaenda check up tena wakampima tuzo wakakuta imeisha.
Sawa. Asante sana Florence kwa kupiga simu na siku njema. At least that is a testimony that there is a light at the end of this tunnel. I did not hear you, Diana. What was your... All right, we have feedback on social media. That hashtag is the new normal. Paul, a friend of mine, started vomiting blood, probably at night, and no pain at all. What could be the reason? Because he has stomach ulcers. Daktari.
So that is what we call upper gastrointestinal bleeding. It's a medical emergency. The common causes are either, it depends where you come from. In Africa, the common cause is actually varices in the esophagus, which is veins that burst, which can occur in the setting of liver disease, okay? And for those who are from Kisumu and the other areas, it could be due to schistosomiasis. The most common causes of vomiting blood is, in most settings here, is peptic ulcer disease. Okay, but the blood is different. The other ones usually vomit because the amounts are massive. You vomit frank blood. This one vomits coffee ground vomiters. Okay, so that is possibly. Sometimes individuals may say be swallowing blood because they're coughing out blood. Okay, that is one reason. But mostly you have bleeding in your esophagus or stomach, so you're able to vomit it out. Rarely, most people, if they have, most likely, if you have bleeding in the duodenum, you're likely to, and in the stomach, you're also likely to present with dark stool, duct starry stool. So that is kind of a bad sign.
Okay.
Yes, so it's a medical emergency.
All right, and still on how extreme it can get, we talked about feeling faint, trouble breathing, nausea, vomiting, as said, unexplained weight loss. Is it because somebody can't keep anything down?
Yes and no. Yes, if you have an, if you can't keep anything down, you may have an ulcer, you may have obstruction, but it also may be a sign of cancer of the stomach. So by the time you already get that, it's usually late. If somebody is losing weight, and you have a stomach cancer, it is usually late, and most often than not, the doctors cannot do much about it. That is why it is important. The message I think that needs to go out is that Helicobacter pylori is important in the sense that it's a cancer-causing agent. Okay, so that's the challenge, and that is why doctors want to sometimes treat it. Most often not want to treat it. So it's a cancer-causing agent and causes gastric cancer or stomach cancer.
So the earlier you go when you start getting the first signs to see your doctor, the better for you.
Yes, please.
All right. So Paul, please tell your friend to see a specialist as soon as possible. We have Catherine calling in from Juja. What's your question or comment?
Hello.
Hey, Catherine.
Hi.
What's your question?
I've been having this burning sensation for a very long time, and sometimes it gets very worse. I've done H. pylori test, both the brand and the stool. I've done OGD. I've done MRI, and there is no ulcer seen. It always tests negative. They have kept on giving me some medications and antacids, but I don't get well. I'm always on and off. I sometimes get bloated and indigestion. And then the other question is about my daughter.
Okay.
Last year she had some ear problem. So when I took her to the ENT, she said she had reflux. That's what was causing the pain in the ears. So I just wanted to ask, how can I get help? And is there a connection between the ear problem and the reflux? And she also complains of the burning sensation.
All right, good questions there. Thank you for calling in. We also have Winnie from Nyamira. What's your question or comment? I think we lost Winnie, but for now, let's take care of... do we have her? Winnie? Winnie from Nyamira, are you with us?
Yes, hello.
Hello, what's your question or comment?
My question was, on September 2020, I was diagnosed with duodenum ulcers. And then I was given some medicine. I was vomiting blood. So I took the medicine. After some time, after some time, I started eating soil. For now, I have the lower abdominal pains and the backache, so I don't know what's the problem.
You started eating what? You started eating what?
Soil.
Soil?
Yes.
Okay.
I was told I did not have enough blood in the body.
Uh-huh.
So the problem is I have started eating soil.
Okay, and this is supposed to give you back the what exactly? How is it supposed to help you?
It's not helping me because it's not helping. I was given some medicine which could make the blood come back to the body because I was vomiting blood.
Okay.
So it's not helping me at all. So I need some help.
All right. Thank you, Winnie from Nyamira. Well, let's start off with Winnie from Nyamira.
So this desire to eat soil is called pica. So you can have pica to desire to suck ice. You know, pregnant women sometimes when they are anemic, if you go in some of the marketplaces, the
stones.
Yes. So it's an indicator of iron deficiency. Okay. And how do you lose iron? If you're a lady, yes, you may lose iron through your periods or something of the sort. Men usually don't lose iron unless they're bleeding from the gut. Okay. And since he has been having a lot of bleeding, he needs to see a medical practitioner as soon as yesterday. Okay? They need probably to correct his iron and find out why he's bleeding. So that is very important. The fact that you have that desire means that he should be having very low levels of iron. Okay.
All right. And we had the lady who first says she's had an issue, a burning sensation, has done all the tests they are, but nothing comes positive for ulcers to at least explain the burning sensation. What could that be?
You have the diagnosis. You have the diagnosis. Remember what I said at the beginning?
Yes.
1, 2, 3, 4 causes. So if we don't find anything, what is the diagnosis? It's functional bowel disorder, probably. Okay. It could be something else, but it looks like functional. But again, that is conjecture. She needs to be fully evaluated, and probably through a multidisciplinary team they discuss and with the patient and find out, and does she meet the criteria for functional dyspepsia? Yeah, that is open to discussion, but it looks as if she meets that criteria.
Okay.
Then in regard to gastroesophageal reflux disease, yes, you can have extra esophageal manifestations of reflux. So when you have the reflux of the fluid from the stomach, you have two components. One is acid and the other is pepsin. So pepsin is a protein that is meant to digest protein. Okay? So a protein that digests protein.
Okay.
So when it gets in contact with the upper airway, then you may have those symptoms. So most of the studies show, studies are beginning to show that there's a relationship between reflux and, say, sore throat, ear pain, and etc.
Okay.
It's complex, but some doctors have seen that when you treat the reflux, the other problem recedes.
Okay.
Even chronic cough, you can have reflux that causes chronic cough.
In this case, seeing that this is affecting the daughter, do we see such cases more in children than adults?
Either way. It can occur either way.
Okay. So to that question I asked before we took a break earlier, you keep saying go see a specialist. Gastroenterologists in this country are very few and far between. Why is this, Daktari? Yet clearly the gut seems to be the core of our health.
Well, doctors are scarce there are not enough doctors.
Yes.
And gastroenterologist is a super specialization amongst specialists. So it's no surprise that there are few. And of course, the training and understanding that goes around super specialization is quite deep. So it's not a surprise. But probably the solution would be to break it down for the other practitioners so they can be able to manage the disease better. Okay, so sometimes what people do is come up with guidelines and directions. So you have the gastroenterologist taking care of the most complex, but the less complex are being taken care of either by the general practitioner or by the physician or internist. So we kind of split that up. And of course, if you have the general public knowing about the disease, then it's much easier to manage the disease. You push away misconceptions, you go by what is the evidence, what are the benefits and risks of your treatment. I think that is most important. So I think having this talk is just one of the opportunities for addressing that challenge.
Okay, I understand we have Matunga from Tana River. Matunga, what's your question or comment? Matunga? Matunga, uko nasi? Okay, we seem to have lost him. So let's talk about the risk factors here. They're listed as smoking, drinking alcohol, having untreated stress, eating spicy foods. Let's talk about smoke and drinking alcohol. Faith, is this something that you partake of?
No, I don't smoke, I don't take alcohol.
Okay, so you cannot say that it has any effect on you in as far as what you deal with on a daily,
No, that one I cannot relate.
Okay, and how about your family members?
They also don't they don't smoke, they don't drink, but out of experience that I've seen, having worked in the hospital, the alcohol attributes so much on the ulcers. Yeah.
All right, let's hear from Brian. So, are you a partaker of these, and if you do, how do you manage it?
You know, Gladys, I could already hear our directors and producers in the gallery already laughing, waiting for my answer. Well, perhaps, I don't know, occasionally, maybe once in a while, but really the stomach doesn't allow you to have a drink every now and then, so not quite.
Okay, Brian, please say that again. I could barely hear you.
I started off by saying that I could already see our directors and producers in the gallery already waiting and laughing to hear into my answer. But the stomach really does not allow you to have a glass of whiskey or a bottle of beer, really. So not quite.
Okay, so you're very wary of this.
Yes.
Okay, let's talk about the risk factors, Dr. Apart from the ones that I've mentioned, are there any others that...
So your smoking and alcohol tend to be exacerbation factors, so they tend to worsen the situation.
Okay.
So, and they put you at risk if you take it either of the two for a longer time. You're at risk of, you say if you take alcohol, you've seen people having, they have taken quite an amount, they end up vomiting here and there, thrown out of the car or something of the sort. Smoking and alcohol tends to put you at risk of cancer. So, and smoking per se is associated with impairment in the protective layer of the stomach and of the esophagus. And of course, smoking, there are certain compounds which may affect the surface of the esophagus, which may lead to esophageal cancer. And that is usually diagnosed also late, and more than often not, most patients do not survive. So because most of these cancers are in the lining of the stomach and intestine, so they grow inwards other than outwards. By the time they grow outwards,
it's too late.
It's a little bit, it means that the tumor has spread to the rest of the body, so you cannot get it out of the body. Now, risk factors. Risk factors, as I say, we go back to the main causes.
Okay.
I always keep on taking you back, rolling back the causes, rolling back. So H. pylori, how do you get it? Oral fecal. Sometimes we don't have a vaccine. I wish we had a vaccine for it, etc. So it's quite a challenge. Okay, but in the West, of course, the prevalence has reduced, or the frequency has reduced, probably because of cleaner water, drinking water, and so forth. So you have safe water and sanitation. So those are the things that can help.
Okay.
And of course, treating people. Other risk factors, of course, is misuse of drugs. Of course, the painkillers, everybody goes to a pharmacy or something of the sort, buys, I need this painkiller for XYZ, and that can put you at risk. So for peptic ulcers, strictly that is it. If you move to gastroesophageal reflux disease, it's associated with certain diseases. For example, obesity, okay. It may also be associated with asthma and so forth. So at least obesity we can kind of modulate, but asthma we may not be able to modulate, although there are some new drugs that seem to work on both diseases at the same time. What else? Of course, herbal remedies, they're like drugs you can avoid. So those are the things. Functional bowel disorders, they're related to your environment, related to the individual. So it's the individual supposed to play around and see what they can modulate. If they fail, the doctors may give drugs, but often the individual is the doctor and the medicine for their functional bowel disorder.
Okay, we have Matunga back on the line from Tana River. Matunga, what is your question or comment? Matunga, unatupata? Hello, Matunga? Okay, at this point, let's take a short break here on Your World. When we come back, we'll hear more from Daktari, even as we understand peptic ulcers more and also understand what's happening in your other world. Stay with us.
Family is working together today. It is creating opportunities for a lifetime of happiness. The future is bright because you can always bank on family. Family Bank, with you for life.
Breaking news from Mulfix. Let's see what they're developing right now.
That is just for me. It really feels very comfy.
Mulfix pants with anatomic fit technology. New Mulfix pants, an invention from babies for babies.
You should also try Mulfix.
Heaviness and a burning inside. It could be heartburn.
Indigestion and heartburn? Eno gets to work in 6 seconds and works on the 6 symptoms of heartburn so you can keep living life non-stop. Eno, fight heartburn and indigestion fast.
From far with you. I even gifted you a magnificent house. Rosa, it's the thought that counts. Please help me.
When it comes to fever, you need to be both. Panadol Baby and Infant starts to work on fever in 15 minutes and is gentle on the tummy. Panadol Baby and Infant, tough on fever, gentle on your child.
The Cooperatives Movement. 14 million strong membership and in excess of 732 billion shillings in deposits. New regulations and their implication.
Overally, then it means the entire sector now will be under regulation. With the addition of 400 non-deposit taking circles, that increases the market coverage to about 96%.
prudential guidelines, and compliance.
Liquidity management is a challenge that a number of SACCOs face, and that is principally because of the asset-liability mismatch.
Streamlining the market.
It's our view as an authority that there is need for consolidation.
In the next edition of Business Redefined, we speak to the Chief Executive Officer of the SACCO Society's regulatory authority for this and more.
Try Panadol Advance for relief from headaches, body aches, and fever. With Panadol's Optizorb formula, the tablet gently breaks down in the stomach, quickly absorbs, and starts providing pain relief in 15 minutes. For fast and effective pain relief that you can trust, try Panadol Advance.
We're back on Your World. My name is Gladys Gachanja, understanding peptic ulcers. And we've had a lot of feedback coming through. Remember, that hashtag is new normal, even as we understand if you're living with this condition or know somebody who is living with it and what the challenges are. And for whatever question you have, we still have Dr. Opio with us. He is a gastroenterologist to help us with the sense of it. And Brian and Faith giving us their experiences living with peptic ulcers. But before we get back to that conversation, let's take a look at the other world. Now, a baby has been born following a uterus transplant for the first time in a town in Egypt, in France rather. Now, such births are extremely rare but not unprecedented and come after a cutting-edge procedure to transplant a healthy uterus into a woman whose own is damaged or missing. The baby, a girl weighing 1.845 kilograms, was born on Friday, according to the team at the Fork Hospital outside Paris. Mother and baby are doing well. The 36-year-old mother, whose name was given only as Deborah, was born without a uterus as she suffered from a rare condition known as Rokitansky, which is a syndrome which affects about 1 in 4,500 women. She received a uterus transplant in March of 2019, performed by the same team that delivered the baby from her own mother, then aged 57. Elsewhere, an amusement park in Dubai launches world's tallest sky flyer, which is as tall as the Pyramid of Giza, according to the park manager. Milton D'Souza, general manager of Bollywood Park, says standing at 460 feet tall, Bollywood Sky Flyer is the tallest swing ride. It outbeat the Orlando one, which stood at 450 feet. It is something that has taken us quite some time to build. It took 600 days and another 120 days to install this ride. It has 421 tons of steel, and that's how we achieved the world record. Anastasia, a tourist from Germany, says it's interesting. You see the whole city, so it's really refreshing and it's really a lot of fun. I really recommend this. This is the point to those of us with height phobia say, hata nadawa. I would not partake of it. Now, suits are out, sweatpants are in. Remote working is changing work clothes habits, and old school office attire should emerge from the pandemic far less starched and strict. Fashion psychologist Dawn Karen says the pandemic has accelerated the arrival of the Silicon Valley chic in New York City and changed people's relationship to their outfit choices.
Designers are now creating collections that are sort of fantasy to have you escape reality, if you will. Right now, the pandemic has evolved our fashion choices. Now we are getting dressed from the waist up. We now can't leave home, and so we're wearing the same outfits every day. I do believe that the pandemic accelerated the casual wear or the Silicon Valley chic attire. It was coming from California all the way to New York eventually, but now that we're in the pandemic, it has increased it or accelerated it. Actually got dressed for others, for external reasons, the weather, your boss, what's mandated. But now, because we've had this peculiar situation, this pandemic, our relationship with fashion will cause us to think about ourselves, why we are wearing something, dressing for our mood, and the workplace will be allowing that to happen.
They're looking for comfort and wear joggers and cashmeres or like knits and whatever, and then they're now looking for escape. Somehow they want to escape from like what's happening in a sense, yeah. So that's just what I currently observe.
Well, a 2,600-foot runway is open to the public in Alton Bay in Lake Winnipesaukee in the U.S. state of New Hampshire, and the runway was built on the frozen lake as soon as there was at least 12 inches or more of solid ice evenly distributed through the bay area.
We plowed earlier. We have a ice runway here that is open to the public, that is sanctioned by the FAA and the state of New Hampshire. This is where we store all the planes. Once they come and arrive, they land, we help them and control with them to park all the airplanes so there isn't chaos and people not knowing how to park in here and getting a jam. We won't drive our trucks out here without having at least 12 inches of ice. If we have 9 inches here, 12 over here, 10 down there, we don't open. Not until we're even everywhere. Last year we did not open because that didn't happen. It was one of those winters, it was too warm. The ice was sketchy and it was uneven thicknesses, so we didn't open last year.
We get that a lot from the pilots. Weirdly enough, it's like they weren't expecting it to be slippery, and it is. Turning, stopping, those are all really difficult moves. They are very easy to do out on paved or grass runways, but here on ice, it can be very different. And there is a little bit of snow cover on the ice that gives it just a little bit of grip, but it's not very good.
So clearly global warming is here with us. Well, back to that conversation of the day, peptic ulcers, and you are still talking to us on that hashtag new normal, even as you give us your experiences with this condition. We have Jayden who's back asking, vomiting blood when you have ulcers, what's the difference with a TB patient? Good question, Dr.
So TB patient usually coughs out blood, okay? It is if you have a cavity seated somewhere there and the vessel bursts, you cough out blood, then you swallow the blood. While for somebody who is vomiting blood per se, in truth, you have blood exiting a vessel in the esophagus and usually in the stomach. It pulls there, then you vomit out. So the process might be the same, but the source is different. Yes.
Okay, we're bringing this conversation to a close, and I'd like to hear from both Faith and Brian in as far as your journey or management of peptic ulcers is concerned. Clearly you are a testimony that you can live a full, fulfilling life with this condition. Again, what would you like to reiterate to others who are living with this condition? Let me start off with Faith.
Okay, as I said earlier, this has helped my journey, and whenever you have an issue with somebody or you're going through something or you have an expectation from somebody, don't assume that they understand or they should know by their own. Like the newlyweds, that affects us so much. So approach your partner, approach your friend and tell them, this is my expectation from you, this is what I want, this is what I'm going through. And that way it becomes so easy because that person will understand you and will help you walk through the journey. The other thing is live a day at a time. Don't bombard yourself with everything. And even the Bible says, don't worry about tomorrow. Just worry about today. Live today. We only live once. So take everything at a time, one day at a time. So don't be stressed up with things that you will not even change. So worrying does not change anything. And if worrying changes anything, then you should not be worried. So that is what I can advise my listeners and viewers.
Okay, Brian, what is your parting shot?
I think really it's basically what Faith has talked about. Live a day at a time. That's number one. Number two, learn to let go. I have a very big problem with letting go issues. With issues, unajipata unashikilia tu mambo vitu za 20 years ago. I remember in one of our meetings we spoke and we said there are some people who get affected by news. I used to be that person, and coincidentally I found myself in the industry of news, but I would watch news and it would really stay in my mind and be like, oh my God, so people died. So the other politician called this other politician, what, you know, it can become very, very taxing. But live a day at a time. And then also, it really is not a joke, because constantly, I'm a Chelsea supporter, and when we lose, my fellow fans would be, Chelsea metupatia ulcers. My friend, you really do not want those ulcers. It can get really, really tough. Then again, it's also to get to understand and be open to other people and let them know this is a condition that you're living with. This is something that you would like, because I would visit someone's household maybe for the weekend and they would feel maybe niko na maringo kwa sababu amepika pilau, amepika stew iko na spice, and I can't have that. And if you request for perhaps a meal from outside or a change of that, mwingine anaweza akachukulia kwamba uko na maringo. So really is to understand this other person who lives in the condition and just take a day at a time. That's the most important part.
Very well said. Daktari, back to you, even as we bring this conversation to a close. Let's talk about the complications. You touched about the internal bleeding and some that become even a surgical emergency. Which are the other complications that are due to untreated peptic ulcers?
So maybe going back to what Faith and Brian has said. So they have just discussed what health is. Yeah. So it is physical, mental and social. Okay. So you have complications like mental. So if you have pain all the time, you're going to have a poor quality of life. So peptic ulcer is associated with poor quality of life. Okay. And social, you may have challenges socially. Your relationship may be affected because you're waking up here and there. You may affect your family and so forth. And there are other social aspects. Everybody can come up with a complication in the audience. The physical, we have talked about bleeding, okay? We have talked about pain. We have talked about perforation, which is an emergency. We have talked about cancer, and we have talked about persistent vomiting, because you can get an ulcer which causes scarring. So it causes a blockage so that food cannot go. So those are the main problems associated with peptic. And of course, financial. It's very costly to have peptic ulcer disease because you have to get treatment. You may have to do an endoscopy. You may have to seek health care here and there. You may be off work for a couple of days and so forth. So the complications are wide. Okay, they say prevention is better than cure. Your words of advice? So the most important thing, in my opinion, I have to be corrected, is empowering the individual with information, education, and knowledge, and trying to communicate what the problem is and what can be done. I think that's the most important. Then the rest follows. So, for example, Helicobacter pylori, it's in our environment. We don't have a vaccine, but the so-called WASH, which is water and sanitation and hygiene, is very important. And of course, if an individual has the infection, appropriate treatment is very important. It can be eradicated, but you can also get reinfection. So, but eradicating it is possible in this day and age, despite antibiotic resistance or treatment failures.
Most people normally complain about how tedious it is to take this medication associated to H. pylori.
Yes.
But it is critical that they finish their medication.
Yes, it is, but the doctor also has to explain the side effects and come up with mitigation methods and probably change their antibiotics. Because if you don't put yourself in the patient's shoes, for example, if you take the antibiotic and you definitely, if you've taken the antibiotic, you know you may have more pain than the ulcer, but it doesn't mean that they are not alternatives. And probably taking the medication after food is better than taking it on an empty stomach. So you, as I say, you need to profile your patient and also educate your patient and probably encourage them to complete the treatment. If they have side effects, you need to stop immediately and find alternatives. Okay, so the treatment is more or less driven by the doctor and the patient. So you work together for the benefit of the patient.
All right, very well said. And that was Dr. Christopher Opio, who is a gastroenterologist attached to the Aga Khan University Hospital. We're also joined by Brian Moshiri, Faith Moeni, who are both living with peptic ulcers. And we thank you for engaging with us through phone calls and, of course, social media, even as we try to understand better about peptic ulcers. Now, before I bid you farewell, there's still some stories that are making headlines in the other world. Now, pub the Taranari was shattered by the coronavirus pandemic lockdown, but was given a new lease of life as Ireland's first wildlife hospital. Now, a baby goat, injured swans, and a solitary fox have already been admitted to the pub's converted outbuildings.
We've just taken in some swans, some buzzards, and this little pigeon here. And we're bracing ourselves for orphan season, which is our busiest time of year. So we get lots of baby birds, baby foxes, etc. And that will keep us busy for the next 6 months.
And I think nature has saved a lot of people through the pandemic, you know. So I think that's probably one of the reasons that they're coming to us now and they're aware of us. They're just generally more aware of wildlife and they know they exist and we coexist.
Now, elsewhere, Dave Pearson almost died when he was attacked by a shark on Australia's east coast almost a decade ago. Since then, he has united hundreds of bite survivors to support each other through the aftermath of an attack through the Bite Club. Pearson still serves at the same beach a bull shark ripped into his arm in 2011 and says the club was so important to a group of survivors who can feel isolated and alone in recovery.
He probably knew he was going to die that day, I think, at that point. And then he prays, he said, "Father, I pray for my friends, please keep them safe, please." And those 3 guys, I said they were 3 boys. They were boys up till that point, I think, because then they made the big decision of trying to bring my son in, which is at least 20-minute paddle without him. So it's a 20-25 minute paddle dragging someone that's not helping you.
Bottom jaw of the shark got stuck in the nose of the board, and as it came through and flipped out of the water, its nose hit me down the side of the head, but my left arm went forward and its top jaw clamped on my arm and trapped that between the other side of the board. It took me down to the bottom of the ocean and we swam around for a little bit. We sort of got out of each other's way and finally got my arm free. It wasn't until probably, 10 seconds after sitting back on my board and looking at, like, my arm was completely torn open and there was bone hanging out, and I realised then I'd actually been attacked by a shark.
The Bite Club that Dave's created is just fantastic. I didn't realise there were so many people around, and it's opened it up to an international group of people.
First meeting, I took that away, in that there was something in meeting other people who had been through the same experience. And like, if you're a cancer sufferer, and you've gone through we know so many people who go through the trauma of cancer, and if you can just find that other person who's gone through the same, you can feel better just by spending time with each other. And that's what this is about.
So that's it here on Your World. Tomorrow we shall be back same time, and we shall be getting our hands dirty, literally, even as we learn the craft behind pottery and understand the business angle, but also how it can be such an ideal skill set to take up. Join us then.